Guys, continuing with the cardiovascular system pathology, the lecture today is the left ventricular failure or left heart failure. I think probably the most important lecture, the most important topic in the whole the cardiovascular pathology and in the whole pathology. I would even go to that much. I think inflammation and some other things are also very important. Anyways, why this is important, look at the statistics here and you would find out. So look, in the US, about 5 million patients suffer from cardiac failure. Out of those, about 1 million patients yearly are hospitalized. 300,000 patients die of the cardiac failure causes, and majority of the cardiac failures you would see down here are because of systolic failure of the left ventricular heart. That is the topic today. Majority of the dysfunction or majority of the heart failure types are systolic. We'll talk about the types today. The minority is of course diastolic type. Then the diastolic heart failure is most common in elderly and in women. Common causes for the left heart failure, so right now you should know this: ischemic heart diseases, hypertension, hypercholesterolemia. These are the primary major causes. Some congenital defects like septal defect, valvular regurg and valvular stenosis are also participant, but really coronary heart diseases, ischemic heart diseases are the most important. And you know why I'm saying that is coronary heart disease can be preventable. Yes, it progresses with the age as well, but high cholesterol levels are important. Controlling the hypertension is important. Controlling diabetes mellitus is important. So these are all preventable things. A healthy lifestyle is important for this. And finally, the high output failure, which is a separate lecture, is a minor kind of a problem. So with this, let's start. The way we'll study is, first of all, we'll try to understand the definition of the left heart failure. Then we'll do the pathogenesis, what causes the left heart failure. We'll do the findings, the lab findings that you would see. You'll see then the clinical signs and symptoms that you would observe. And of course, as you saw from the stats, probably majority of your patients are going to have some sort of a, majority of the patients with the cardiac problems would have this problem. So make sure that you understand it. The things that we need to understand now is, what is the heart failure? Number two, what is the forward versus backward failure? Number three, what is systolic versus diastolic failure? Let's get those out of the way and then we'll talk about the left heart specifically. Look, forward failure versus the backward failure. Forward failure is that the heart, this is the heart here, is unable to pump enough that the viscera and the tissues can get the blood supply, adequate blood supply. That is a forward failure. A backward failure is that heart, when it is not able to pump enough out, that causes backward pooling of the blood. The blood cannot come in easily as well, and that causes the blood to start accumulating in tissues behind the heart, and that causes congestion, and that is a backward failure. Then is systolic failure versus diastolic failure. So look, heart cycle has two phases, of course, filling phase or diastole, in which heart relaxes, fills with the blood, and then at the diastole time it ejects it. Systolic dysfunction or systolic heart failure will mean that when the ventricle contracts, when it squeezes, it cannot eject the right amount of the blood volume that it should eject. That is a systolic failure. Systolic function is not working. There is diastolic failure as well, where diastolic function is not happening correctly. And what is diastolic function? What is the function of diastole? Diastole's function is to relax the heart during the diastole and allow the heart to be filled with the blood to be pumped. So if the heart is not relaxed correctly, then it will not fill enough with the blood that can be pumped. So that is diastolic failure.